Ever wondered how hypertension or high blood pressure is managed? Or perhaps, what are the different classes of antihypertensive drugs available? If these questions pique your curiosity, then you're in the right place. Hypertension is a prevalent condition worldwide, and managing it effectively is crucial. The National Institute for Health and Care Excellence, or NICE, has set forth guidelines for managing this condition. To begin with, NICE recommends lifestyle modifications as the first step in managing hypertension. This includes maintaining a healthy weight, reducing salt and alcohol intake, eating a balanced diet, and regular physical activity. It's important to note that these modifications may sometimes be enough to control mild hypertension, without the need for medication. However, if lifestyle modifications alone aren't enough, antihypertensive drugs come into play. The choice of initial medication depends on the patient's age and ethnicity. For patients under 55 years old, an ACE inhibitor or an angiotensin receptor blocker is generally the first choice. These drugs work by reducing the production of a hormone that narrows blood vessels, thereby lowering blood pressure. For those over 55 or of African and Caribbean descent, a calcium channel blocker is often recommended first. These drugs relax and widen the blood vessels, which can help lower blood pressure. If the first drug isn't effective enough, a second drug from a different class is usually added. This could be a thiazide-like diuretic, which helps the body get rid of excess sodium and water through urine, lowering blood pressure. In cases where blood pressure remains high despite these measures, NICE recommends adding a third drug from the remaining classes or considering a referral to a specialist. It's worth mentioning that beta blockers, once a first-line treatment, are now usually reserved for specific situations, such as hypertension with heart failure or for certain arrhythmias. In summary, managing hypertension involves a combination of lifestyle modifications and medication. NICE guidelines recommend starting with lifestyle changes and then introducing antihypertensive drugs if needed. The choice of initial drug depends on the patient's age and ethnicity, with further drugs added if the initial treatment isn't sufficient. Remember, each patient is unique, and treatment should be tailored to their individual needs and circumstances. It's always important to review medications regularly and adjust as necessary to ensure the most effective management of hypertension. And with that, we've covered the basics of managing hypertension, guided by the NICE guidelines, and have delved into the main classes of antihypertensive drugs. Whether you're a healthcare professional or someone simply interested in learning more, understanding these guidelines can help in making informed decisions about hypertension management.